Today we're going to talk about cardiomyopathy. Now the different types we're going to be talking about are dilated cardiomyopathy, hypertrophic, which is non-obstructive and obstructive, and then restrictive. Now with dilated cardiomyopathy, there's going to be is the most common type, accounting for more than 90% of the cases. Etiology basically is causes can be from alcohol abuse, chemotherapy, infection, inflammation, and poor nutrition. Pathophysiology is basically it's a subacute or chronic disease of the cardiac muscle where it becomes fibrous, especially the myocardium and endocardium. The chambers become dilated and the mural wall usually has thrombi present in it. Clinical manifestations you're going to see is fatigue and weakness. These patients are going to have left-sided heart failure. They will have some type of dysrhythmias or a heart block. And they will also have systemic or pulmonary emboli. You're also going to see severe to moderate to severe cardiomegaly, and you're going to hear a S3 and S4 gallop with this disease. Now, diagnostic studies for pretty much all your cardiomyopathies is going to be X-ray and echo to determine that they have this. Treatment is going to be basically symptomatic treatment, especially of the heart failure. These patients are going to be put on vasodilators. They're also going to have medications to control the dysrhythmias. Now, if they have to have surgery, it'll be a heart transplant. Nursing care basically is you're going to deal with teaching them about heart failure, their vasodilators, and their anti-dysrhythmias drugs, and also after surgery you're going to perform, if they have a heart transplant, comprehensive cardiovascular and respiratory assessments frequently according to the protocol at the hospital. You're also going to make sure that you list all the signs and symptoms of rejection that are specific to the heart transplant, and these need to be reported immediately to the surgeon. To detect rejection, the surgeon is usually going to perform some type of right endomyocardial biopsy, and these are going to be at regular scheduled intervals and anytime there's any kind of symptoms that occur. And this slide here shows it's just a good breakdown of all the things we talked about dilated cardiomyopathy. You might want to read through this. It's really good information. Next thing we're going to go to is the hypertrophic cardiomyopathy, the non-obstructive. Now the etiology for it is usually unknown. Patho is basically hypertrophy of all the walls, the septum, and then they're going to have relatively small chamber size. So the chambers of the heart are going to be relatively small. Now, clinical manifestations, you're going to see dyspnea with this. Patients are going to have angina, fatigue, syncope, palpitations. They're going to have a mild form of cardiomegaly. You're also going to see ventricular dysrhythmias and S4 gallop. And sudden death is common with this type of cardiomyopathy. Now, diagnostic, once again, X-ray and echo. Treatment is going to be basically symptomatic treatments of all the manifestations that you're going to see. They're also going to use beta blockers, and they're going to use medications to try to convert when they go into AFib. Now, surgery, they're going to do a ventriculomyotomy or muscle resection with a mitral valve replacement. Patients that are on nitrates or any kind of vasodilators, this is all contraindicated with the obstructive form of this of cardiomyopathy. Nursing care is basically going to be the same. You're going to talk these patients about the different treatment options. Also teach them about the surgeries that they're going to have with these different things. On your obstructive, basically etiology is unknown. The patho is basically the same for non-obstructed except for With this type, you're going to have obstruction of the left ventricular outflow tract, and this is associated with the hypertrophied septum and the mitral valve incompetence. Clinical manifestations are basically going to be the same as for non-obstructive, except for mitral valve regurgitation and murmur. These patients you're going to see a lot of AFib with. Diagnostic is the same. Treatment is basically the same, and so is the nursing care. So this goes over hypertrophic. The slide does. Um, the different things going on with that. It's good information. You want to look over this as you're going through these notes. The next one we're going to talk about is restrictive cardiomyopathy. Now, this disease can primarily, etiology is basically it's the primary caused by endocardial or myocardial disease, such as sarcoidosis or amyloidosis. The patho is basically it's the rarest form of the cardiomyopathies, and it's characterized by stiff ventricles that restrict filling during diastole. Now, symptoms are similar to left or right heart failure or both. Treatment and nursing care is basically going to be the same. Prognosis for this type is very poor because of the stiffness of their heart. So they're specifically a heart transplant. This slide here talks about the different things going on with restrictive cardiomyopathy, a lot of good information. And so you want to read over this. Any of this information that's on these slides, remember, I go strictly by the slides. So if it's in my information, you possibly could see it on a test, okay? So make sure you read through these really well. This last one just shows the differences between the three, between dilated and hypertrophic cardiomyopathy, and it shows you the differences in between all of them. That's it for this slide presentation. There'll be more to come.